I wanted to talk about CHIP. Now, CHIP is something that may not be necessarily familiar to everyone in our audience. So if you could tell us a little bit about CHIP and how that's really sort of playing into some of your current research approaches.
CHIP is a term that stands for Clonal Hematopoieses of Indeterminate Potential. So let's just call it CHIP for now. So this goes back to what we talked about earlier about the intersection between cancer and aging and cardiovascular disease. So if we think that cancer, the experience and its treatment accelerates some aspects of the aging process, it would be ideal for us to look at specific markers that we can use to detect what someone's biologic age is, not what their chronologic age is in terms of where they were based on their date of birth, but their true biologic age is. And until now, we've had a really hard time identifying that because, if you can identify it early on, you can target, you can screen, you can do risk-based management, et cetera. A few years ago, in the general population, this concept of CHIP came out, which is all of us, as we get older, develop these what we call somatic mutations. They're essentially these genetic changes that happen in our blood as part of the stem cell renewal process. For many of us, they don't mean anything. They just circulate around. And then the prevalence of these things start increasing. So by the time you're in your 70s and your 80s, about 10% of your cells will have some of these mutations. When we looked at our cancer patients and our cancer survivors, what we saw, in fact, that the prevalence of these circulating cells in the context of remission were nearly 2 to 3 times higher than what you would expect for the general population. In the general population, when you have these circulating cells, you're at much higher risk of developing cardiovascular disease and other aging-related issues. So we put 2 and 2 together. We said, well, wait a minute. If cancer patients have a higher risk of aging conditions and cancer patients have a higher risk of these CHIP mutations, can we see whether or not these CHIP mutations are associated with the cardiovascular issues that we're talking about? And lo and behold, we actually saw that these circulating CHIP mutations, in fact, were associated with a much higher risk of cardiovascular disease in cancer survivors. And that gave us some insight into biology, that maybe there are some blood biomarkers and measures that you can actually use to quantify the biologic aging process of a patient and ultimately deliver specific interventions to focus on that aging process.
See, I think this is brilliant because as a solid tumor oncologist focused on kidney cancer, I get blood-based DNA reports on my patients all the time. A lot of my colleagues do as well. And we don't really know what to do with that CHIP piece of it, as you've described, right? Because as the name implies, the IP stands for indeterminate potential. So I love the fact that there's some sort of science behind this. And I think one of the new things that City of Hope is bringing to the table, and I'm going to see if I can get a sneak peek of this from you here today, is a CHIP clinic, a clinic that actually focuses on CHIP. Is that something that's sort of in process? I think it's a brilliant idea.
A CHIP clinic is what you're referring to is essentially if in patients who are in remission, you see these circulating cells that may be associated with a higher risk of issues developing later on, can you be more proactive in a clinical setting, as opposed to letting them go out into the community essentially and be lost outside the sort of the oversight of our clinics and our programs? I would say that the time for that is in the near future. One of the things that we've been so great about City of Hope is championing evidence-based medicine. And I would argue that if we're going to do a CHIP clinic, ultimately we would need to deliver evidence-based interventions to lower the risk of X, Y, and Z. So right now we're at the point of observation, understanding why it's happening, and now we need to develop the interventional trials based on these CHIP markers to see if you make a difference, if you intervene on it or not. So we're in the process right now of developing the first randomized clinical trials around that, where you can use this biomarker as a way to guide your different interventions. And I'm optimistic that down the line, that's going to lead the way for our establishing CHIP clinics across cancer centers.